I want to explain to you what an upper cervical correction or adjustment means. The top vertebrae in your spine, we call the atlas vertebrae, cervical vertebrae number 1, rests right at the base of the skull. And when the top vertebrae misaligns, because this is the only thing that really keeps our head on our body. So when the top vertebrae misaligns, we call that a subluxation. And a subluxation is the misalignment of the top vertebrae disrupting or interfering with normal nerve function. So as an upper cervical doctor, there's got to be a specific way to make a correction to this vertebrae. Your head is going to be placed right at the edge of the table here, and your shoulder sits just about here, so nothing supporting the neck, kind of like sleeping on your side. The atlas vertebrae, as it rests in this abnormal position, what we're going to do is unlock this vertebrae according to your misalignment. But before we do that, we elevate the table just about a 1/4 inch. And the reason that is that the table will actually drop about a 1/4 inch and sometimes even 1/8 of an inch just to help us unlock the vertebrae. More of a natural correction without any twisting, popping, or snapping. So here we go. The atlas vertebrae rests in this abnormal position. So as this vertebrae sits in a crooked position, what I'm going to do as your doctor is unlock that vertebrae. And once that bone begins to shift and unlock from that misaligned abnormal position, as soon as that bone begins to slide, the head is going to fall with it. And you'll hear a noise as the head falling. And that enables this top vertebrae to completely unlock. And the body's intelligence, because let's face it, the body knows what's right for it. The problem is just there's an abnormal locked position of that vertebrae because of the fact that muscles have adapted to the bone's abnormal positioning. And in time, there's an abnormal bony mold. So what I want to do is get it out of that mold so the body can reset itself, if you will, by normalizing nerve function. Again, I elevate the headpiece, unlock this vertebrae, and when that bone begins to slide off the skull, the head will follow it, and this bone completely unlocks, and the body's intelligence resets the vertebrae. Now, once the vertebrae's been set, we get you on up very carefully and have you lay down in one of our private resting rooms. Allows those muscles to adapt to the bone's new position. After your rest, we get you back on up, sit you on down, and perform a second neurologic exam to confirm 2 things. 1 is your doctor, that we analyzed and made a proper correction, but 2, more importantly, that your spine is now functioning at its optimum.